excited to have in front of us the Sierra Health Foundation presenting us with the mental health state of emergency in communities of color. Yeah, go ahead and put your hands together for that. Yeah, they are, when we decided to do a panel on mental health, the state of mental health in Black communities and communities of color, we said, well, let's go with the experts because these are the persons who are on the ground doing the work. And so we were so glad to have Chet Hewitt send his team here to be with us on today. And we're going to go ahead and just turn it into the hands of Ms. Amaya, who is the Program Officer, Community Responsive Wellness Program for the Black communities of Sacramento with the Sierra Health Foundation. Let's give them another hand as they come. Let's test the mics. There we go.
Okay.
Mic
Hello.
check.
Thank you so much, Dr. Takoy. Good afternoon, everyone. All right. It is an honor to be in community with you all today. And welcome to the Community Responsive Wellness Reducing Barriers to Mental Health and Wellness Services in Sacramento's Black Community panel. My name is Amaya Noguera. I am the Program Officer managing the Community Responsive Wellness Program, which provides free mental health and wellness services to Black community members throughout Sacramento. CRWP, you can find in the back, consists of 4 local community-based organizations and a larger network of educators, mental health practitioners, artists, activists, cultural custodians, and healers, right? So these are the day-to-day, on-the-ground practitioners that are working to really address a lot of the concerns that were brought up in the previous panel. Today, our panel will focus on how to improve access to and the quality of behavioral and mental health services in communities of color. We will explore the importance of prevention and early intervention strategies that focus on developing awareness, critical and compassionate thinking, and that foster opportunities for culturally responsive counseling and dialogue, healthy intervention, and support. We will use the CRW core values as a framework for how we discuss our programming and approach to addressing these barriers. At the heart of our work, our core values consist of 4 deliberate and intentional areas. The first is affirmation. Validation and appreciation of Black people, culture, experiences, and perception is at the core of our work. We believe Black people need and deserve safe spaces, and affirming Black people is central to that. Compassion. We believe we can transform ourselves and the world through trusting and caring relationships, because caring engagement is what drives this work. Wholeness. Our approach to well-being aims to be holistic, and we recognize that structural, cultural, and direct violence on Black people is a disease that can be countered by remembering who we are and where we come from, why we are here. And lastly, collaboration. We can't and won't address the individual and community needs of Black people in Sacramento without working collaboratively together. A deep appreciation for collective work and responsibility informs this work and work we will continue to do in the future. And now, I would like to take a moment to introduce you to my esteemed guests and colleagues that are sitting here with me. I have these are very important people, and they are also very modest because they are living and breathing and doing this work, and it's hard work. It is often, we don't take the time to recognize and show appreciation. So, Miss Renita Harris, please raise your hand, Renita. She is the program manager for the Roberts Family Development Center's African American Healing Network. Renita believes that there is no such thing as voiceless communities. They just need the mic. She plans to take the community-led approach to closing the gap in access to mental health services for African Americans living in Del Paso Heights. Renita is a Sacramento native that currently lives in Del Paso Heights. She graduated from Luther Burbank. She received a BA from Howard in sociology, and she is currently studying community development at Iowa State University. Keke Brown is the program director of Soul Space, a program of OnTrack. Soul Space provides mental health and support resources to African Americans throughout Sacramento. Keke is a native of Omaha, where she served as a mental health officer for several years before coming to Sacramento. Keke has served as a community advocate for over a decade in her hometown. She is a mother of 2 college freshmen and a 10-year-old son. Born and raised in Sacramento, Timothy Poole is the founder of Hooked on Fishing, Not on Violence. His role in the community has been to inspire the youth and challenge leaders to personally initiate independent judgment and planning to embrace new ideas, commit to social justice and cultural diversity with enthusiasm for bold social change. Timothy's nonprofit organization gives inner-city at-risk children and teens a chance to receive mentorship through the art of fishing. This organization has embraced over 1,000 children with the opportunity to participate in seasonal fishing derbies with the Sacramento Police Athlete League, teaching the community to generate a sense of belonging and personal growth accomplishments. And last but definitely not least, we have Dr. O. Dr. O holds a PhD in education with an emphasis in language, literacy, and culture. A 2010-2011 McNair cohort scholar, Dr. O has a devotion to youth, families, and community. Born and raised in Vallejo, California, Dr. O continues to positively impact and inform educational experiences of young people through his research and service. Dr. O is currently the chair of Equity, Diversity, and Inclusive Education Program in the Graduate School of Education at Touro University in California. Dr. O is also a co-founder of Black Academics, a weekly podcast engaging educators across the nation in critical dialogue about academic success for African American scholars. Let's give it up for these panelists. So I have the honor and privilege of working alongside these incredibly dope healers, leaders, warriors of light, and I just want to share their brilliance with you all. So if you will, this is going to be a more kind of informal dialogue, really to generate their thoughts around some of the questions that I have. So the first question I have is, the United States of America was founded on the institution of slavery. Black people built this country. What is the lasting impact of slavery on the state of mental health in this country? Any of you feel free to take it away.
Peace and blessings, everyone. Mr. Tim. And so to answer that, it would be the mindset, right? The mindset that we have taken from slavery. And a lot of us think that Black people's history started right at slavery when it didn't. And so because of the thought process, we're not able to move forward in a lot of our ways of going, right? We get stagnated, we get held up by just our thought pattern. So because of slavery, a lot of us have a depiction of who we are and what we are.
I will add to that. I also think it's in the systems that are currently in place. In every system that you look at, African Americans are represented at a higher disproportion, regardless of what system it is in. And a lot of times you're not allowed to speak up for yourself. You're not allowed to ask questions you're expected to do, which goes along with what Mr. Tim was saying. And when you do decide to speak up for yourself, those systems then give you labels. You're angry, you're aggressive. My favorite one is you're combative. Well, I'm not combative, I'm asking a question. So that's how I see that playing out.
With that question, I think about the lasting impact that slavery has had on white individuals in the system. Their practices and belief about Black health and about Black people as humans hasn't changed. And so it's ingrained in the system. So even when we look at Black mental health and we look at some of the things that we go through, they think that we can handle certain pain. So we have deaths with Black women who are pregnant. Even with our practices that we have culturally practiced throughout generations, they don't look at it as a mental health activity or a mental health therapy, which in actuality it is. But because of how they deemed us in slavery, it's still ingrained in that system and in their mind.
I should have went first. I gave them all the opportunity, and I got to rethink my thoughts. In the movie Wakanda, that's the name of it, right? Yeah. In the movie Wakanda, Angela Bassett says, "Show them who you are." But how can you show somebody who you are if you don't even know? And so when I think about the lasting impact of slavery on mental health, I think about the identity crisis that our community still is going through. Having an opportunity to work with the youth, our youth still don't quite understand who they are. And it creates mental challenges because as you're trying to figure that out, you're dealing with competing messages about who you are. And it creates, James Baldwin said, it creates a state of schizophrenia because you say I'm this and then you say I'm that within the same sentence. And it's not just the world, it starts at home. Mama calls you a king, but then says you no good within the same sentence, right? Because she's still trying to understand who you are as well as who she is, right? Your friends will call you king, but then call you nigga in the same sentence, right? And we don't understand how the juxtaposition of those two identities, right, are clashing up against each other. And so when I talk about my mental health, when I talk about my mental well-being, when I talk about the ability to be healthy within that space, I'm thinking of how slavery, as Du Bois said, gave us a dual identity, where I see myself, but I also see the way you see me. And I'm asking myself, which one of those is real? Is it who you see or is it who I see? But what happens when I see what you see? And then we be getting this space where now we're like a dog chasing his tail because I'm trying to figure this space out, right? And so when I think about the lasting impacts of slavery on mental health, that's really kind of where I start at.
Yes, yes, let's clap it up. So to follow up with that, are you seeing any cultural shifts in Black communities around acceptance of mental health support in programs that provide culturally relevant access to mental health care?
Absolutely. In our program, Soul Space, we have people literally coming to the door and saying, I don't think I'm okay. And so we try to give them their words because we need to hear your story. And then what we try to do is let me love on you a little bit because we have resources, we have partnerships, so we can take care of that side of it. But the fact that you even came, because prior to that, we weren't allowed to say we weren't okay. We were expected to kind of pull yourself up by the bootstrap, and I always used to ask my grandmother, I don't got no boots. And then the boots I have don't even have a strap, so what does that mean? So we're dealing with clients who are being told, pull yourself up, shake it off, you got it, come on, let's go. And then you turn into Superman and Superwoman trying to do all these things, and your own mental health is declining. And usually what happens is you get so fed up, the mental health comes out in how you treat people, your inability to do certain things. And so, yeah, we are seeing our folks coming and saying we need it and we want it.
Peace and blessings all. As for me, I work with a lot of young folks and we give them a safe space to come to, right? And so how we find out that they're not equipped with the cultural aspect of who they are, we let them know it's okay not to be okay. You know, because they think they have to be a certain way. It has to be okay. But it's okay not to be okay. And so in this safe space that we provide, it's called a youth healing circle. We allow our youth to come together and speak on holding them back, or what obstacles are in their way, that's not letting them navigate life in a fair, because, you know, we are not in a fair game. This game where we are 5 steps behind other ethnicity groups, or 2 steps up front, right? And so what we have to do is remind our young folks is to be the best them they can be, get all the education you can get. I know my grandma used to tell me, she say, son, get a good education so you can get a job, a good job. But as we know it today, the job market is oversaturated with a bunch of geniuses that can't even get a job. And so I just ask the young folks to rely on a good mindset to see them through for their next step, and may their next step be a better step.
I think the answer to that question is a resounding yes. But being open does not necessarily mean that we take an advantage. And taking advantage in the ways that we need to be taken advantage. I think, particularly with the young folks and the adults that I have the opportunity to work with, for example, on my farm, we do a community healing circle with the drums once a month. And we have a good, 30 to 50 folks that show up for those drumming circles, right? That's a form of therapy that we're engaging in, and the more people find out about it, the more people are willing to come through and participate. But that therapy looks very different than sitting down with someone who may or may not look like you and having conversations with them about things that you don't want to have conversations about. And so I think in some aspects, we are open to the idea of therapy. We're open to the idea of needing to be more cognizant of how we manage our mental health. But it's hard to actually get into the space where not only do I do it, but I do it consistently. Because the first session is okay. The second session is all right. But the third session, when you tap into something, or the fourth session, when you tap into something that makes me uncomfortable, to then push through that and continue to go and continue to seek and continue to open yourself up for that. That's where I still see a little bit of resistance. But I think one of the responses to that is, how do we couple formal therapy with informal therapy, right? Brother Tim said this earlier when talking about some of the young men he works with, that we work with them for 1 or 2 hours and then we send them home. And I think the same thing goes with any sort of formal therapy, right? You have your hour or 90-minute session and then you have to go home. But what do you go home with? Who is that person that you can talk to that does not create such a formalized therapeutic environment, but gives you an opportunity to work through some of those things that you need to work through in between those formal sessions, right? So it's not a matter of are we more, but it's a matter of how do we continue to cultivate a specific type of therapeutic structure that is unique for our community, so that we take more advantage of it, even for folks who says, I understand that I need it.
I think there is a shift. There's still a long way for us to go, but I think the fact that we're here on church grounds talking about mental health service and therapy shows that there's some sort of shift. With Roberts Family Development Center, they were very intentional on the partners they selected when coming up with our network. And it's churches, individuals, community leaders, LGBTQ centers. So we're all working together. And then the most important part is that we have African American therapists. And there's something to that, because that's a language in itself. And so when our individuals come and speak to a therapist, they do go past the 3 sessions because they finally feel like they're being heard and not judged. And there's something about seeing someone who looks like you in the practice. I wish that there were more individuals that were therapists. I would like to see a shift more in that, where we see more African American Black male and women therapists, but I definitely see a shift.
Thank you, thank you. Yes. So for Renita, you just mentioned something, and I know that you all have gotten really creative with ways to kind of do some outreach to individuals that may not be as ready. Can all of you speak to some innovative strategies that you have either utilized or seen and want to incorporate into your work to be able to reach those individuals that are perhaps deemed in other areas and other institutions unreachable, or that they don't want the kind of help and support that is, free and available to them?
Money. We pay folks to get therapy in the work that I do. And here's what I mean by that. I believe that working with your hands, opens up the doorway to healing. Because there are multiple barriers that a lot of us put up that prevent us from really opening up and engaging. And so we invite folks to the farm to work, and we pay them to work. But they don't understand that when they come to work, they actually coming for therapy. And so we don't wait but 15, 20 minutes into the work before we start asking those questions that need to be asked. How you doing? How's the family? What you working with? What you struggling with? What do you need, right? And you'd be amazed when somebody is sweating and they working with their hands, how they start opening up and talking to you about stuff that they never, and they say something like, man, I don't even know why I'm telling you all this. Yeah, you distracted. You distracted right now, right? And we're going to pay you for this therapy session when it's all said and done, right? And so for us, we're trying to really think about how do we do that in a more formal way, right? How do we actually pay folks to actually receive therapy, to actually have opportunities to talk about what is happening in their lives and engage with viable mentors that are willing to walk them through that process. And so far is having some results for us.
Peace and blessings again, all. Mr. Tim. So my way of doing it is I work directly with youth, 50 to 60 youth in a week, and that's just in 2 classes. And so our thing is the ones that are struggling to keep coming and being a part of the therapeutic session, what we do is we offer them a night of skating, family skate night. Everything's free, food, skates, entry. And so we catch a lot of them right there in family skate night, pull all of our mentors out. And, we can look around the room. You can survey the room and see who needs what, right? And so the other thing is that we have healing by the water. And so I'm a fisherman, right? So I'm having youth come out to the water to heal by the water, because one thing I know, and 2 things for sure, as a parent, sometimes I lose patience. And I don't think everyone or anyone in here deals with patience at a high level. We all get impatient. So our thing is to show them, while they're healing by the water and waiting on that fish to hit that hook, they have patience. But we also want to commune with them. We want to communicate with them. We want to find out what they need, how they need, and where they need. And so we're able to get youth out by saying, hey, we're finna go fishing. We'll stock a pond, so they're gonna catch fish, right? And so once we stock that pond, they catch that fish, we have that talk, and you see that smile, that lets you know that this is a well-needed session. And so we have that every Saturday at Southside Park. If you have any young folks, come on out. We'll have some youth out there as junior instructors and as well as senior instructors.
With Roberts Family Development Center and the Healing Network, we really believe in healing the community from within. So we make sure that we tap into the resources that we already have. So you may see us doing outreach at a hip hop concert, and giving out information about mental health services and how we have Black therapists. One thing that we also do is we turn the open mic into a healing circle. So they think they're coming for an open mic, they're getting on the mic, they're either through visual arts or rapping or singing, or some people just get up there and say a quote. And then at the end, our culture broker, which is someone who helps individuals navigate the mental health service system, gets and does an activity. So our last one, he went by around the group and said, "Why do you love yourself?" or "Do you love yourself?" And so we make sure that we incorporate some form of mental wellness activity within what they're already doing, to let them know, like, you're already practicing, you're already working on your mental health, even though it's not deemed as a mental health activity in the normal form of things, but we're tapping into what we already have, our strengths that we already have, and then connecting them with the Black therapists.
So Soul Space was very intentional about creating a program that was for us, by us. And so we spent almost a year doing focus groups in the communities that we wanted to serve, because it was important to us that we heard what the community needed and what they wanted. And so then we took all that data, and that's how we formed the core concepts of our program. So connecting, like Robert's family, we also connect to Black therapists, but I'm picky, so I need to weed some of these therapists out, right? So not only do we connect you with a Black therapist, we have a relationship with those therapists. So we're warm transferring you. We're going to your appointments with you, sitting in the car if that's the type of support you need. Also providing some of that support in between sessions and teaching some of those skills that maybe you may not learn necessarily in therapy. The other thing that we were super intentional about is creating safe spaces for our people. So our rule is you come as you are, and it's your story, and we don't get to rewrite it. So we have a support group for our Black men called Alive and Well, and that's ran by one of our coworkers, and there's all types of men in that group, and they come and they talk about things that are relevant as a Black man. I facilitate our women's group, Let It Go Sis, and again, that's a safe space for us Black women to take our cape off and really get to the core of what's going on. And then the thing I think I like the most is our staff is exactly like the community we serve. So I came from a whole different side. I was in law enforcement for a long time. One of our staff members was in jail for 17 years and is still on federal probation. He's just as important as anybody else in the building. We have staff who have mental health diagnosis that are working every day to make sure their mental health stays stable and well. And that was important to us. So that's some of the things we're doing.
Yes. So many kind of questions are coming to me just about, just thinking through these values that are listed, right? Affirmation, compassion, wholeness, and collaboration is woven into all of the programming that you all mentioned, all of the ways that you engage, the ways that you reach out, develop and grow relationships and sustain them. I want to know, given what we know about the current state of Sacramento, right? Because it's not unique to Sacramento, it is happening all over. Gentrification, right? Housing is a huge issue. There are so many things out of our direct control. How do you see, and what do you see as kind of hope for the future of Sacramento, given this particular work that you're engaged in?
Peace and blessings all again, Brother Tim. So the collaboration between all of these organizations, CBOs, the collaboration, Keke can call me and ask me a certain question about a certain topic, and if I don't know the answers, I'm able to go to Renita. And if Renita doesn't have it, I'm able to go to Dr. O. And there's a lot of us that we can go to. So the collaboration is what was needed and is needed in Sacramento to get the message out and to do the work.
I agree with Mr. Tim. I think for me, coming from a whole different background, like I wasn't raised in Sacramento, and one of the first things that stood out to me, and I believe Amaya and I have talked about this, where I'm from, there is no collaboration sort of like this. It's still a very segregated city. When I came out here, I was amazed at the ability to be able to call a Mr. Tim and say, hey, I have a crisis. My area is this. I can't fix this, but who do you think I can call? And I can get Renita or Dr. O or whoever on the phone, and we're going to work together to make sure that family is taken care of. And nobody's trying to take the credit. This is a community thing because that's what we believe in. So when you think about what's going to work for the future, it's not only the work we're doing now, but we have a whole generation of advocates coming up, and they're hungry. And so it's up to us to make sure that we're passing the torch just like our ancestors did, because that's what has to happen.
I agree with both of them, but I also think that with Sierra Health and you, Amaya, I've seen a lot of county representatives now coming to us for the answers, where they usually used to move like they had the answers, but they're starting to realize that they don't. And so I think that's a shift, and that's what Sacramento needs and needs more of, for them to realize, government agencies to realize that you don't have the answers to our community. So
Say
that's
it
what I'm
again.
saying.
Yeah, I'm gonna just piggyback on what Keke was saying. I pay tremendous homage to our elders in the community that have been doing this work and have created a solid foundation. But if y'all don't know, please look these folks up. But there are a tremendous amount of young folks who are running their own initiatives in the city that are not waiting for the torch to be passed, but are actively working beside our elders right now in trying to do the work, right? And that's extremely important because we see communities that don't have a succession plan in place. And we see what happens when the gap that is left when folks decide, hey, I can no longer run this race, and there's nobody there to continue to work with them. And I don't know what y'all put in the water here in Sacramento, but we got young folks who are graduating from high school with a mind to do the work. Like, they not even waiting until they have a mind to do the work starting from high school. They're thinking about, how do I start an organization in high school? They're going to college. They're starting there. Like, we have a bunch of 20-somethings in the city that are doing tremendous work. And now all they need is the funding, the business acumen, and the support to scale up. But I think that is something for us to, I be feeling sometimes, I be talking to some of the youngsters, and I'm only 40. I be saying, like, what have I been doing my whole life? Yeah, I'm looking up to y'all, like, can y'all mentor me? You know, tell me, how do I do it? And so that to me is a tremendous cause for optimism for Sacramento.
Amaya, I have one other thing. Renita reminded me of this. The other thing that I love seeing in our community is accountability. So we've been in spaces where people will come present stuff about our community, and they're usually not us, and they say things, and then when you start to ask them, okay, well, where's that coming from? Did you include African Americans when you gather that? It's a beautiful thing to be able to stand in your truth, hold someone accountable for the misinformation they're putting out in your community, and doing it in a way that honors not only yourself, but your ancestors, because we have that happening a lot. People will come into our space and tell us how we should feel, how we should think, and tell us what's right or wrong, and won't even include us in the dialogue. So I think that's also part of that.
Ashe. Yes. Thank you. Yes. And, you know, I think my question was also really what I was hoping I would generate or spark something from within each of you is our relationship to land in Sacramento, into physical space, in space that we can control and manipulate and create as a sacred space that affirms Black people, right? Because we know that not all spaces in Sacramento or in general do. So about intentional creating and carving out spaces where that can exist. And so you mentioned the farm, Dr. O, but I would love for you to speak about some of that, and then the rest of you, just in terms of, you talked about the river, right? And our relationship to nature, our relationship to this earth and this land that we're in, right? Gentrification is a very real thing, right, where people's stability is in question daily. Talk to us a little bit about some of those spaces and how they've come to be, what they do, how people can access them.
Let me first, in answering that question, let me first talk about my baby. My baby is an artistic young person, and she's chosen to channel her artistry through nails. She came to me, she's 18, she came to me and said, "Daddy, I don't want to go to school anymore. I want to go to nail school and become a nail tech." And as an educator, I immediately balked at the idea. Ain't what I look like with a PhD and my baby going to nail tech school, right? That's the first thought that ran through my mind. And then somebody said to me, "You know how much money these nail folks is making?" And so I blew it off again, and then my baby came to me and said, "Daddy, look at these nails I made," and they were beautiful. And she said, "Somebody just paid me $120 for this set." I said, "You can get $120 for some?" She said, "Yeah." She's like, we ain't playing like this." It caused me to have a shift in my mindset. We train our children to be employees. We don't train them and rear them to be employers. I start there because it's the same way when it comes to space. We have trained ourselves to ask for space. We have not necessarily trained ourselves to curate space, to take ownership of space, to say, I'm going to buy this building, I'm going to buy this street, I'm going to buy this whatever, and then I'm going to create the thing that I'm asking to be created for us. And so when I think about how did the farm come about, it was really about acknowledging God's purpose in my life and understanding that we're moving out of the space of asking people permission to use what they own to develop what we want, because they always have the capacity to come and say, "No mas. This can't happen here anymore." And I think we have to like get ourselves in that mindset, right? We talk about home ownership, and home ownership is important, but we also need to talk about ownership beyond just the home. How do we begin to start investing in commercial real estate? How do we begin to start investing in these dilapidated buildings that are boarded up and signed up in our communities to say, "Ooh, that don't look like nothing right now, but I see what it's going to look like. I see the vision. And more importantly, I see the people that are inhabiting that space." I look at this space right now and I say, without the people that are in here in this building, this is nothing but four walls, right? It is the people that are here. That's the vision that we have to start having. And so for me, that's all it was when it came to the farm. Is I said, what does it look like to own acreage and then to have our babies literally running from pillar to post, from fence to fence, not worried about surveillance, not worried about somebody telling them to stop, not worried about any of the things that you got to worry about when you go to the park across the street, right? And then to say we got more space than they even have at the park, right? And so that is really kind of where, and I'm really trying to encourage some of y'all, our youth, to start thinking in that way as well, right? You want to start the organization, you want to start the business, but as you are starting, think about the ownership of it. Think about how you can take. I love what Mr. Roberts has done in Del Paso Heights, because he owns, I want to say, half the block that he owns. And so if you're going to do anything on that street, you got to go talk to Mr. Roberts, because he's created, right? They almost need to rename the street after him, because he's created a sphere of influence that begins with him saying, we own this, right? This is our footprint. And so that's really kind of where the vision for the farm came from.
I just really like what he said about planting the seeds. So we don't have a farm over at Soul Space, but we do have a park across the street. So sometimes what I will do is take clients over to the park, and you just teach them how to sit in nature. You teach them how to sit and listen and pay attention to what their spirit is wanting to say. And sometimes you'll be surprised at how you can relieve stress by simply listening to the birds chirping, or maybe kids in the background playing, or whatever it may be. And so I try to use really simple ways, because we're working with people who don't have sometimes the ability to go out to a farm, or maybe they don't have the finances to do different things. So that's one of the ways we try to do it, but just connecting. And sometimes you have to show them, breathing techniques. Just, again, different ways that when you leave me in this space, you have something to go with you, because you're going back into a space maybe for you that's not safe, or that's triggering, or whatever that may be. But that's one way that we try to utilize space.
Peace and blessings all, Brother Tim. And so on the 19th, the 20th, leaving the 21st, we'll be at the Westgate Regional Park in Lodi, where we go camping. We teach our young folks how to pitch a tent, make a fire, feed themselves, but not only that, to listen, like you said, to nature. Observe some things that you don't see in the concrete jungle, And a lot of our kids, I'm going to say this, and it might seem funny. I took some kids out to Emeryville to go fishing on a charter boat. And when we left from over at Miss Jackie's office on Franklin. I put in 10 kids in a van, and we start going. And when we got on the 50 and start going over the Sacramento River, one of the youth said, "Hey, man, we at the ocean already." He was calling the Sacramento River the ocean. What I'm trying to say is that our kids don't know what they don't know. And so unless we get them out of the environment that they do know, they won't get to know anything else. And so that is that.
Okay. Uh, All right. I do want to leave room and time and space if any questions arise from the audience. So I will close with this final question to you all. I spoke with each of you at various times, just telling you that I really just want you to come up and just talk about what you do every day. And I know that's a tall order, because there is so much that goes into all that you do. Some of you are just leaving juvenile hall, or are in and out of schools, and are navigating spaces on an ongoing basis. So I want to leave this question very broad and very open. What other things do you want to say about how to improve access to behavioral and mental health services in Sacramento's Black communities?
I feel like that's a really tall order, right? Because we all have, I think, ideas, and we're still dealing with systems that were put in place that are out of our control. But I think the most important thing for me anyway is I just have faith that it will be exactly what it needs to be, and I'm just required to do my part. I'm not required to do the rest of the work. So I have to stay true to my part, and I have to show up every day and be intentional about what my part is. So when you come into my space and I say, this is a safe space, it's exactly that. And showing up sometimes can be hard, because you hear a lot of things, you see a lot of things, you're dealing with people who have experienced life at some of the most horrible times. And so we are committed to making sure that we're present during those times. We don't want to just see the end result when everything's all rosy and cute. We want to be there when it's not so cute. So we show up in crisis situations. We'll sit in court. We do all those things because we know it's needed for the bigger picture.
Peace and blessings, everyone, again. Mr. Tim. For myself, I just left juvenile court, right? I'm an advocate for the juvenile system and our youth. And what I do know is that a lot of our young folks who are locked up, they lose hope and sight of what is real in their life and what is fake and fictitious, right? And so what I want to say is that not only the TV, the music, the internet, has our babies' mindset thinking one way. We have to be intentional in speaking life into them. We really have to speak life into our babies because the world is against them. Nobody's coming to save them. And if we don't try to get them to understand, when I say try, I normally don't say try, but it's a different world now than when I was a young kid. I didn't have internet, so therefore I had to talk to Amaya if I liked it, Amaya. Or I had to talk to Brother O if I needed to get something from Brother O. But right now, they can go on that internet and be international in 2 seconds. They'll be in China, right? And so we have to be intentional on what we feed our young babies and what we allow them to be fed.
So as far as access goes, when it comes to what we do at Roberts Family Development Center, one of the issues that we face is that some of our most vulnerable Black people don't have access to therapists because a lot of the therapists can't get through the Medi-Cal system. And so access can be improved if the systems would realize that the old way of doing things is not working, and listening to our Black practitioners and giving them some type of leeway or some type of change in how they can access and help the individuals that can't necessarily afford culturally relevant services.
What was the question again?
Increasing access.
Increasing access. My initial thought was we got to keep the main thing the main thing. Avoid distractions. Stay on course. Sometimes it seems as though we're not making progress, but we really are. It's like I remember one time floating in the water, and I looked up, and I was nowhere close to the beach. I kind of panicked a little bit because I was kind of far out there, and I don't know if y'all know I'm a big boy, so that was a long swim I had to get back on. But I think if we keep the main thing, and I deal with this a lot in education, we got to teach our babies that the work that we doing is a viable career. Financial literacy is the key to wealth building because it's not about how much money you make, it's about what do you do with the money that once you get it, right? I think our babies think that wealth building is if I make $1 million, I have $1 million, not understanding if they make $1 million, they're gonna spend $1.1 million, right? But the work that we do, we're still able to provide for our families. We're still able to live enriching lives, right? We're still able to wealth build in the careers that we're choosing, and our babies need to choose this career so that they can provide more access, right? I think Renita is the one who said, like, we need more. We need more folks who look like us to get into this industry, and by default, we will create greater access when we do. But the people who are going to get into this work are the babies, and they have to know these are viable, respectable careers that can take you to places that you never thought that you would ever go before. And so I think the more that we can do that for them, the more that we can make them understand the value in the work that we do, the more access will naturally begin to develop within our community.
Ashe. Yes. Okay. So now I'd like to take a moment, and if there are any questions for our panelists, to please come up to the microphone. But I do want to close my kind of thoughts, given all the things that you all shared. And I just want to honor that part of this work, at least from my tenure in this particular project, right, because this work far superseded us. And yet, part of this work that I think collectively we have been on has been around reclaiming our humanity in the process, right? That we are only as good as the cups that we are able to pour from, right? And so maintaining boundaries, healthy relationships for that collaboration to tap out when you are too much, or when it is too much for you. And so I just want to appreciate you all for carrying that spirit, coming and delivering that. And then I'm going to turn it on over to this question.
This isn't really a question. This is just a statement. I worked with Hooked on Fish and Not on Violence, because you're the young men that you work with go out and help at different events, and I work with them at the Black Chamber. It was funny too because they ran in groups, but they were so great. I mean, they were engaging. They were, the girls worked harder than them, though. I want you to know that, and I told them that too, so they would get up. But you know what? It was really fun working with those young people. It was engaging. I mean, they were really a great group of kids. I just wanted you to know that. And I've recommended them to, every time I go somewhere and they need somebody to help out, I always let them know. I give them your number. I got your number in my phone book. Okay? Right on.
Thank you. All right. Well,
I commend all of you. I have enjoyed listening to you, and I want to know, where is the farm? I want some addresses and emails and phone numbers of where we can get in contact with someone, because I was looking in here to see them. I don't see them in here. But the other thing was, do you have an outreach program for seniors in my age group? Because I know a lot of seniors go through mental health issues and depression when we retire, and different things that we go through. And so I wondered if there's resources for seniors out there also. And also, I wanted to ask you, Ijeoma Ononuju, is that how you present? Are your parents from Africa, or is that a name that you've taken on? Because my husband's from Nigeria, that's why I asked you that.
No, I'm Nigerian.
Okay, yeah, because my children went through mental health issues as a result of their father being Nigerian. They were asked if they lived in a hut, and if they swung through trees on the way home, and different things. So they had to. They're first generation on my husband's side, first generation American, and so those are a lot of mental health issues that they dealt with, just ignorance, because they have a Nigerian father. So I thought I saw your name, so I figured.
okay. Well, anti-Blackness is most definitely a disease.
And I
For
can
the
piggyback.
elders,
I was going to say, can I piggyback onto her question, because you all can probably answer it? That I think the themes, I'm seeing some recurring things from all of the panels, and just in terms of even the financial health and the mental health, and how it's all connected to everything. And I'm in DC. We're having these same conversations, and UDC is trying to have funded a master's degree program in mental health that the city will pay for if the recipients agree to stay in DC and practice, because there's such a deficiency of mental health professional, of Black mental, especially in the Black community, mental health professionals. So is that something that you could see happening, or have you seen it before? Just that's all.
Most definitely. We actually had a panel here at Sierra Health Foundation in October where Dr. O was featured, and we had a partner from Boston, Massachusetts come out, and we are exploring what the model that they've used, where they are actually working with high schools to create cohorts where they are able to funnel them into BA programs and then on to graduate programs with the hope and intention that they will come back and serve in that particular community as practitioners. So that is something that we are exploring models and looking at ways to take this work, since so many of these programs work in schools in collaboration with districts, and we have Dr. O is with Touro University here in California. We have partnerships with universities and colleges, and we welcome all exploration, because we want to create more pathways, and it is very, very, as they all mentioned, the youth are ready, right? We need to create those places to guide them.
And so I just wanted to ask, there was a question asked, is there resources for seniors? And so, yes, there is. You can go to our website, or you can go to hoffnov.org. find out information right there. Leave your name. We'll call you back. We always need so what I always tell our young folks, you need an OG to lace you up in this game. You need an OG, right? Because you don't know everything. Even though you think you do, you don't know everything. So get your OG so they can lace you up in the game. And so, yes, just hit our website, or I have cards in my pocket, and I'll be able to give you one. And we'd love for you to come aboard to help with giving our young folks correction and direction.
So Soul Space, you can Google Soul Space Sacramento, because my email is way too long to try to put out there. But I did also want to say that we absolutely hold space for the elders in our community. Whatever we put out there, whether it's a workshop or support groups, we always envision our elders there because we need that wisdom, we need that lived experience. The other thing of getting folks ready to enter the world as a Black provider. So aside from what I do at Soul Space, I have an LLC, and one of the things we're literally in the progress of doing is working with UC Davis. So when we have African American students who want to become therapists or maybe in law enforcement or do like a specialized task force like I did, who's your mentor? And we take those folks into our program and we show them the ropes because we want them to love it. We want them to see the passion in it. And we also want them to see that it can be a lucrative business. We're not in it for the money, but we do have obligations to our families to provide. And so that's something that we're very intentional about. So we have 7 ladies under our leadership right now. 2 are freshmen, the rest are getting ready to graduate, but we've taken them to meetings with us. We've had them run meetings. Practice with clients, safe clients. That way they get that experience and they really have a good idea of, is this something I really want to do? Because we require commitment. We don't want to open these doors up to our community and then shut them down because we're not ready.
Thank you. And I will just lastly mention that in the back table, I've provided a little QR code which actually has each of the organizations. It will take you to our homepage, and then you can follow and look at their individual organizational web pages from there. Thank you all.
Come on, let's really clap it up for them. Sierra Health, mental health state of emergency in communities of color. We're gonna take a picture. We're gonna take some photos. I need that photo music right there. Yeah. And thank you for those who stayed, throughout our panel. We lost one. And we're like, go ahead and come on, up a little.